Non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen, naproxen, or aspirin, are some of the most commonly used medications to help chronic pain, inflammation, and fever relief. But did you know that chronic use of these medicines could wreak havoc on your gut health? Here's what you need to know about what chronic use of NSAIDs could possibly do to your gut. Number one, it can cause something called intestinal permeability, or it's commonly called leaky gut. And this is where the tight junctions in between the gut cells are loosened. So as a result, things like bacteria, viruses, toxins, and even undigested food can get into the bloodstream where they're normally not supposed to be found, and thus trigger a whole host of immune reactions, setting you up for inflammation, autoimmune disease, and much more. Number two is it can cause imbalances in your gut microbiome. And your gut microbiome, which is in your large intestine, is so important. They are doing so much research on how an overgrowth of certain bacteria might make it more likely for you to have or develop a chronic disease. Keeping your gut microbiome in good balance is crucial for optimal health. Number three is stomach ulcers and internal bleeding. Chronic use of NSAIDs disrupts that mucus layer in your stomach, thus leaving it susceptible to developing ulcers. In fact, about 15 to 30% of people on chronic NSAIDs will develop an ulcer at some point. And if it's not caught or treated, it can lead to a life-threatening GI bleed. Number four, chronic use of NSAIDs can also affect your nutrient absorption, especially for things like B12, zinc, iron, magnesium, which are essential for energy and immune function. So some signs that your gut is suffering from NSAID overuse are frequent bloating, gas, or stomach pain, chronic diarrhea or constipation, unexplained fatigue or brain fog, worsening food sensitivities. So if you're experiencing any of those symptoms, or even if you're not and you've been on chronic NSAIDs, I would encourage you to work with your functional medicine provider to figure out the underlying root cause of your pain. And if you do need something for pain, to find a much safer botanical alternative, as there are many that have been studied to help with chronic pain. If you like this video, please follow or subscribe. Please like or share, and have a fantastic day.